Okay, my friends, I've been following the coronavirus obviously since it started, and I think I understand the chemistry. I think I understand the tissues that are being affected. And this guy's going to show 12 autopsies, the results of 12 autopsy cases that reveal up to patients how they die from coronavirus. Now, I think I fully understand this myself, and I would love to engage with him, and I think we can correct this in a matter of hours, literally, with probiotics. Now let's see this is the first time I'm watching this, so we're watching it together, and here it goes, and I will obviously comment as is necessary.
This video is a follow-up to my last video, which was called What Doctors Are Learning from Autopsy Findings of COVID Patients. Just after I published that video, not even a day later, this study came out, published in the Annals of Internal Medicine, which I'll put a link in the description below. And what makes this study such a big deal is that it's the first study that looked at this many autopsies of patients who died of COVID. Not only did they do complete autopsies, but they used CT scans to scan the entire body for blood clots. All 12 of the deceased had tested positive for SARS coronavirus 2 by means of RT-PCR. Now I want to say something. Not everyone on this planet is going to get COVID. For those who do get the virus, 80% of them will have either mild or no symptoms. Roughly 15 to 20% of them will have pneumonia. Roughly 4% will develop ARDS, or acute respiratory distress syndrome, and or shock with multi-organ failure.
Now, my statement is none of them would have anything happen to them. They would be in that first group with a mild to almost nothing whatsoever if their guts were good.
And about 1% will die of the infection. When I'm in the ICU and someone dies, it's obviously horrible. Sometimes autopsies have to be done irrespective of family consent when it's a legal matter. Rarely, depending on the circumstances, we ask families permission to do an autopsy. Most families decline the option for autopsy. But during this pandemic, it's especially important for autopsies to be done because they often provide incredibly valuable information, especially when we still know so little about COVID, especially when it can present in so many different ways. So in this study that was done in Germany, autopsies were mandated for patients who died of COVID. And to the families of those victims of COVID, my condolences. And we're still trying to figure out why some people do so poorly when they get the virus, while others do just fine.
It's the gut bacteria, my friend. And I would say that in the COVID patients that I've been studying, it's connective tissue disorders. It's collagen 1 is being destroyed or converted to collagen 3. That's my take on it at this moment. And I haven't seen your video yet, sir, so let's see what you have to say.
And then there's everyone in between. So the point of this video is not to scare people. The point is to learn about the disease and to ultimately benefit from that learning with the hope of developing treatment options and ultimately reduce morbidity and mortality. In other words, to save lives. And by making this video, the goal is to educate myself and others about what we're learning and getting the medical truth out there to the public. So in this study, there were 12 patients total, 9 men, 3 women, and
hello everyone, I'm coming directly to you.
Age was 73. All patients had some type of pre-existing medical condition. Most of them had obesity and or underlying heart disease, such as coronary heart disease.
Coronary heart disease is a problem with the way the heart is pulsating. Obesity, they found an enzyme that affects obesity. These are all enzyme-related issues, and construction of tissues and so forth, and destruction of tissues.
Some had type 2 diabetes, hypertension, peripheral artery disease, asthma, COPD.
100%. I'm going to tell you what. Let's look up any one of those and then gut bacteria. Let's look up COPD. Let's start at the bottom and then we'll move our way up. Look at this, scholarly articles. Well, there's none. Currently, there are no published studies of COPD and gut microbiomes. Several factors associated with CB are known to cause dysbiosis of gut microbiome. No, gut microbiome causes COPD. Thus, it is predicted that there is dysbiosis of the gut microbiome in COPD patients. All right, let's look at the next one. All right, here you go. The role of microbiome in asthma, gut-lung axis. In conclusion, the function of microbiota and healthy immune response is generally acknowledged, and gut dysbacteriosis might result in chronic inflammatory respiratory disorders, particularly asthma. And it also destroys the lungs in COVID. All right, here you go. Hypertension and gut bacteria. New research suggests gut bacteria might be linked to high blood pressure, depression. A study of humans, a gut microbiome, so high blood pressure, depression may be completely different disease than high blood pressure without depression. It's strictly related to the bacteria, though, because the bacteria also is 100% related to how you feel, if you're happy or unhappy. All right, here it is. Gut bacteria may be linked to type 2 diabetes. A study found that there may be an association between bacteria in parts of the body and type 2 diabetes. 100%. Anything, unless it's like a broken bone, is gut bacteria. And if you don't have the right gut bacteria, you won't heal from the broken bone either. All right, this just goes back a few months back. Could the gut microbe be linked to autism? 100% it is. Marguerite, her son, was going to be in a locked room. He had no communication with the outside world. He was 9.5. We put him on probiotics, and within 3 weeks he was actually speaking. And then now he's, as Marguerite says, he's 80 to 90% now. Where he had no hope, they told her that there was no hope for him and it was all over. Plus, my friend Roger was going to die, and he took Primal Defense, which we have no affiliation to anybody, but he took Primal Defense, and that's what she's given her son. She gives him the powder, and he took the pills, but they told him to go home and die, and he took them, and he looks pretty damn healthy to me now. And that was many years ago. There's a terrible mistake. They got it 100% backwards. The gut bacteria causes the issue, not the issue causes the gut problems. 100% wrong. And nobody will speak about this problem. Not a single word since COVID came out. And I have been extremely vocal, and not one single person on my sites, who I have like 87,000 people, not one single person has been sick that has been taking probiotics. Zero. Zero. That's with a giant Z. Somebody should stand up and push these people towards, you don't have to make something that invades the body with a bacteria or a virus, just so your pharmacies can make money. You need to be healthy on your own. I'm sorry, the things got to change in this world. And this is one of the worst things I've ever seen, not to be doing, because you see, everywhere I look at, well, nobody's really looked at it. Nobody's really looked at that. There's no studies on that. No. I've done the studies. I know it works. All right, if you're not familiar with what I'm talking about, go back to my last video. I was going to tell you how these bacteria that live in these white blood cells create enzymes. There's a lot to it, so I can't go over and over and over and over and over, which I do. But go back and look at this, because every single thing that I am talking about refers to the fact that there are bacteria that create enzymes. The enzymes are just magnificent chemistry sets. So go back and look at this, my last video about that, if you're concerned about that. I'm pretty sure I went over enzymes, that that there is a ton of different enzymes, and they're all over the place, and they do different jobs. Fats and glucose and sugars and neurotransmitters. This is so important, because all of these neurotransmitters, Marguerite found out that her son, when he lost some of the probiotics, he couldn't take it. He had something was wrong with his gut, and he couldn't take the probiotics, and he lost his motor function, but he didn't lose the nerve connections. So there's something in there that works on the nerves down in there, and something that works on the motor functions, and something else that works on tissues, and something else that works on all of these different body fluids and so forth. They play, enzymes a huge part in day-to-day running. They run the body. They are the body's system, nervous system, muscles, much, much, much more. Very, very, very important. All right, remember, this is Dr. Mike Hansen, and this is 12 autopsy cases reveal truth about how patients die from coronavirus. Now, and again, I have not seen this yet. Well, I've only seen up to 258 here, and we went and discovered that virtually everything is related to gut bacteria, and in an opposite way that they think. Or maybe he does. I don't know what he thinks. We'll find out.
Initial lab tests revealed elevated levels of D-dimer, lactate dehydrogenase, meaning LDH, and C-reactive protein, or CRP. All of these are non-specific markers of inflammation. There's also mild
Inflammation strictly means that your tissues are being invaded by something, or they're being overloaded with something, or they're being broken by something. There's a million different possibilities here. They could be being hit by toxins, there could be a problem with the pH, there could be a zillion things, but they will literally all be related to some gut signature.
thrombocytopenia in some patients, meaning low platelet counts. This isn't an unusual finding in patients who are critically ill. They also looked at levels of viral RNA using RT-PCR studies. All 12 patients had the SARS coronavirus 2 RNA in their lungs. 9 out of the 12 had it in their throat, and 6 had it in their bloodstream. In 5 patients, they had viral RNA in other tissues like heart, liver, brain, and kidney. Not only did they have the virus there, but the levels were higher in those tissues compared to the blood. Here's a picture from a different autopsy that was not part of this study, where the virus was actually visualized in the kidney using electron microscopy. So what is this telling us? It tells us that the virus is binding to those ACE2 receptors in those organs. So in some people who die of COVID, they had the virus in other organs besides the lungs. But, and this is a big but, they did not die as a result of that virus being in those different organs. They died as a result of lung complications.
All right, and I think the lung complications, the reason they have to intubate them, which means force oxygen into their lungs, is their lungs can't do that. And the original autopsies that I saw, well, I guess there was only one I can't remember. It was right in the beginning, and I think they only did 1 or 2. And they said that the lung was almost like a sponge that was full of water. And they were trying to force air into it, and it was actually damaging the lungs. And I think that's where a lot of the blood clots are coming from that he will be talking about. That was my take on it. Here goes.
Also, an important takeaway from this is that all 12 had it in their lungs, and 9 out of the 12 had it in their throat. So when you go to do a throat swab with someone who has COVID, the virus might not even be there. And that's just another reason why you can get a false negative test.
All right, I just want to make another point is, yes, they might have it everywhere in their whole body, big deal, as long as it's being kept under control by the good guys. Because all the other people that don't have any symptoms, they got it too. So this is not any big finding. This just says, ooh, it's here, it's here. Well, of course it's there. But your body has to maintain against it with bacteria and enzymes.
Okay, so they also did post-mortem CT scans of these patients, which demonstrated mixed patterns of reticular infiltrations and severe, dense consolidations in both lungs. This CT scan is a patient with COVID pneumonia and ARDS, not from this study that we're talking about now, but basically demonstrating the exact same thing. Both lungs have extensive consolidations, ground glass opacities, which represent extensive inflammation. These are also known as pulmonary infiltrates. And you can see the difference compared to a normal CT scan of the chest.
All right, pulmonary infiltrants. Let's look at what that's all about. All right, through a series of just blind luck, I ran into some research about neonatal problems with their lungs, and I think I might even talked about it. And what it does is it converted collagen 1, the ratio of collagen 1 and collagen 3. There was an issue between, and this is type 1 collagen content is increased. So The collagens are these strappy fibers. They're fibers. It's increased in lungs of patients with adult respiratory distress syndrome, ARDS. Now, it's increased. So, collagen 1 is these fibrous things. Now, abstract. And this goes back to 1984, I think, 1983. Collagen in lung tissues examined from patients with ADRS, adult respiratory syndrome, from patients who did not have this disease but also required mechanical ventilation and oxygen treatment, and from patients without overt lung disease. And then they talk about the different this and that. And, well, let me just read it. Cyanogen bromide peptide mapping techniques were used to determine the ratios of type 1 to type 3 collagen present in these lungs. So they wanted to see how much of the type 1 compared to the type 3, because that's what makes up your lungs, is basically those fibers. Now, in the fibrous ones, from patients with ADRS, a shift was found in the ratio of type 1 to type 3 from the normal value 2 to 1 to a mean value of 3 to 4 to 1. Now, is that what's happened in COVID? Yes, it is, I believe. In patients with normal lungs and those with other lung disease, collagen type ratios were normal. Right? So they had other types of diseases. ADRS is a different type of disease. It's a distress syndrome. It comes on quickly. Now, our data suggests that changes in lung collagen in patients with ADRS syndrome resemble those previously in patients with what they call idiopathic pulmonary fibrosis, although the changes occur much more rapidly, like to COVID in the former. The increased content of collagen in lungs of patients with ADRS syndrome shown by others is predominantly type 1 and the stimulus to the lung to produce excess type 1 collagen relative to type 3 is not solely or iatrogenic origin, I don't know what that is, resulting from oxygen or ventilator treatment. Well, the lungs are fibrotic. They've stopped being able to be rubbery, basically. And at that point, when they force the air into them, they actually break the fibers. That's my take. And it says right here, the adult respiratory distress syndrome is a devastating disease, diverse causes, which they don't know what causes it, in which a previously normal lung can be transformed into irreversibly fibrotic one in a few weeks, even less, really. These people, they don't even know they're sick, and all of a sudden they're ready to die. Triggering mechanism for this remains unknown. It's because your bacteria is bad, although considerable controversy centers on the relative roles of underlying disease. On the underlying diseases, your bacteria is bad on those too. It's just, they just don't get it. Let's see what happens. All right, let's do this. All right, I hope you remember in that lit up thing where they were showing all the different little bacteria scooting around. Your lungs will have certain bacteria that lives there that might not be present in other areas in your body. So your lung microbiome may be completely different than the other areas in your body. I don't know. Nobody ever's doing any research on this, basically. But they found that if it's different in some people, they're going to die. So they know it's related to the microbiome. And it says similarly, the lung microbiota critically ill patients significantly altered compared with those of healthy subjects. They know this. I can't understand why they don't understand that they come down to the bottom. It says senior study author, who I'm going to try to contact, researcher in pulmonary critical care, stressed that the lung microbiome may represent a novel target for preventing the treatment and treating the clinical illness. Well, it's only bad because it doesn't have the right bacteria. We can't change our patient's genes because it's not the genes. or their chronic disease. Yes, you can, because it's the bacteria that's creating the chronic disease. But we can potentially change their body's microbiota. If you do that, you fix the disease. Study authors note that the next step in research will focus on determining whether modifying lung bacteria influences patients' outcomes. Absolutely will, obviously. Knowing that immune function and the microbiome differ among these patients may not only help us predict our patient's outcome, but change them for the better. Yes, let's find out what type of bacteria is living there, what quantities are living there, what invasions cause what bacteria to turn on, and then we can really start to get into this deep. I'd be down for this in a second. I would love to schedule a way of investigating this, and then we can have some health. And literally, I am telling you right now, in my world, if your gut is right, you are good to go, and all you got to do is talk to Hippocrates, and he would have told you the same exact thing. All right, something I need to stress, and I may already have, but I need to really stress it. When babies are born, they need to go through the vaginal canal or be slaughtered with vaginal juices, feces, urine, in their face, in their mouths, and literally ingested. They need that. That is their immune system. They're being presented to the world. Now, after that, the mother also gives off favorable bacteria and so forth during the nursing process and things. It's very, very, it's an elegant system if you just let it do what it's supposed to do. But when there's, different delivery techniques that don't involve vaginal birth, and then they clean them up so quick, and then they do this and that, that's just not good. It's not the way to do it. It's not nature's way. All right, talking about lymphocytes. Now, I claim that you have to have the correct bacteria virtually in every cell to maintain the integrity of that cell and its overall health. Well, here's what happens. The lymphocyte is a type of white blood cell. It's part of the immune system. So this is supposed to be a good thing for you. The B cells produce antibodies that are used to attack invading bacteria. So the B cells produce these chemistry sets that are used to attack invading bacteria, viruses, and toxins. Well, how do they attack them? The T cells destroy the body's own cells. These are the T cells that destroy our own cells because they have themselves been taken over by viruses or become cancers. So we have to destroy certain things that are just no good anymore. It's called apoptosis. I don't know if that's what they're referring to here with the T cells. But anyway, whenever something dies and you get a signal through the vagus up to the brain that says, hey, send down an enzyme, get rid of that guy, he's dead, or he's dying, or he's going to cause trouble, or whatever it is. And it just happens. Now, if you don't have the bacteria to create the enzyme to do the job, you're done. Now, what is the lymph system? What is that? What lymphocyte? What is that all about? That's how you dump. The lymph system is your dump. And so people get lymphatic carcinomas. And it's cancer because they cannot dump. They don't have the bacteria in there to break down the molecules to do the dumping because they don't have the enzymes. Okay, so we're back to the lymphatic system. Here we go.
Laboratory findings. All these findings represent ARDS. They also found lymphocytes, a type of white blood cell that infiltrated these specific tissues. This fits the picture of a viral pathogenesis. They also looked at the pharynx of these patients, meaning the throat. The lining of the throat, or the mucosa, was hyperemic, meaning very red and irritated, and at the microscopic level they saw lymphocytes invading there as well, again, which is consistent with viral infection.
Of course. The problem is that the bacteria that should be in your gut to send up the enzymes is not there, so you could have it anywhere in your body.
In one case, a patient had lymphocytes invade his heart muscle, findings that are consistent with what we call viral myocarditis. In other words, the heart muscle had evidence of viral infection. More than half the patients in this study had large blood clots. 1/3 of the patients had pulmonary embolism as the direct cause of death. all the others died of intense inflammation in their lungs related to pneumonia and ARDS. Recently, there's been studies showing that about 1/3 of patients with severe COVID have blood clots. Another study.
Well, that's going to be obvious because they're losing the flexibility of that tissue, which is always doing this. It's got to do that. So then when you try to force it open, which the intubation does, then they get the blood clots.
Of 191 patients with COVID-19, half of those who died had clots, compared with 7% of the survivors. And levels of D-dimer that were greater than 1,000 were associated with
The reason they had so many clots was they had less and less ability to have enzymes to fight against the invaders.
a fatal outcome. So it's pretty clear now that SARS-CoV-2 virus is causing a lot of clots to form in moderate to severe COVID disease. But how is this happening? It's likely a combination of reasons that have to do with downregulation of the ACE2 receptor in the lung alveoli, with a subsequent shift towards having more angiotensin II in the lungs and less angiotensin I.
Oh, angiotensin II. Let's look into that. Okay, so more angiotensin II and less angiotensin.
17.
See, I mean, it's absolutely incredible. Intestinal dysbiosis, that's a problem with your bacteria, activates this angiotensin system, contributing to incipient diabetic nephropathy. It's 100% has a problem in your gut, causes this, not the other way around. No, it's now clear now that STARS curve to virus is causing, I don't know what that's all about, but here.
Causing a lot of clots to form in moderate to severe COVID disease. But how is this happening? It's likely a combination of reasons that have to do with downregulation of the ACE2 receptor in the lung alveoli, with a subsequent shift towards having more angiotensin II in the lungs and less angiotensin 1-7.
All right, there's exactly the same thing as collagen 1 converting over to collagen 3. It's converting angiotensin, whatever exactly that is, I don't care. It's basically, it's the same problem. It's the same. And I can't believe they have not put their finger on this. It's unbelievable.
And less angiotensin 1-9 in the lungs. And when this happens, this leads to more cytokine storm with more inflammation, more constriction of pulmonary.
Okay, let's look at cytokine storms. This is how wrong they get it. This is cytokine storms. Now look at this. Colony stimulating factors are also associated, that's the cytokine colonies, are also associated with inflammation, obviously, because they're at the site of some kind of a invading factor. And there is evidence that these factors may be part of a mutually dependent pro-inflammatory cytokine network that includes tumor necrosis factors. We're going to talk about that in a minute, because there's an unbelievable thing they did in Australia, and you will flip when you see it. It is thought by functioning to increase the number of cytokine-producing macrophages at a site of inflammation, colony-stimulating factors may be part of an amplification cascade that serves to perpetuate inflammatory reactions. Yes, there's nothing there to fix it. You don't have the chemistry there to fix it. And there is a guy using TNF, tumor necrosis factor, shooting it up past the blood-brain barrier and correcting people like that from, I think it was Alzheimer's. We're going to take a look at it. Tumor necrosis factor is perhaps the best known and most intensely studied of the pro-inflammatory cytokines. It plays a prominent role in cytokine storm literature. And then it's TNF. Now, I want to show you something, because this blew my mind. But remember this. All of this stuff is dependent upon chemistry, and that chemistry has to do with making and breaking molecules. And there is a thing called the blood-brain barrier, which only lets certain chemistry up into the brain. And this TNF, I think there's a TNF2, maybe, I can't remember now, but let me go back and look that up. But it won't let that specific molecule through, and which tumor necrosis, it kills the tumors. And the guy shoots it up past the blood-brain barrier, fixes him, and like, just like that. The woman looked like she just fell off the top of a mountain, and she was just thrilled. You can't even imagine. All right, check this out. The way chemistry works, etanercept. Now, I haven't looked into exactly what the molecule is, but apparently it can do the chemistry on tumors. Well, it's a tumor necrosis factor molecule. So they claim that it does work on tumors. I don't know what it does, but it does some chemistry on this woman's brain after she had a stroke. Now, after she had the stroke, up past the blood-brain barrier, up here, only certain stuff can get into your brain. And he had to go and shoot it up in here, and it's like that. Watch.
To see.
What's different?
It's only been a brief few minutes since Linda Lumbrough received that injection of etanercept at the base of her brain.
Clear.
Clear.
She's been tipped upside down to allow the medicine to flow into her brain.
Oh my.
Remember, this is stroke-affected Linda just before the injection.
One.
All right, remember, now we have a new way of looking at things. I'm now considering the vagus nerve here, because the vagus nerve controls your speech, your eyes, your hearing, your function, your motor neurons. Every single thing is controlled through the vagus nerve. And that runs up through here, up into your brain. Now, something damaged her brain when she had a stroke, whether it was a blood clot or a blocked artery or some tumor of some sort, because this is tumor necrosis factor. Now let's listen to it.
Oh my.
Look at that. Isn't that
Moments after
something?
the
Look at
shock,
that.
She sits up.
Oh my God.
The change in Linda is something to behold.
It's gone. Hi.
Come over there.
Woohoo! It worked. On me.
Yeah.
Wow.
Ah. In here is clear. Hi. It's me.
It's truly a miracle. It happens all so quickly, and it's done. And before you know it, it's all over with, and then boom.
I can talk. I can walk.
We felt it was likely that she would improve. To improve almost back to normal was just spectacular.
You know, the thing is, I don't think they allow that treatment in the United States. That's what I heard. Maybe I could be wrong. You should probably look into it if you know somebody that has a stroke, and see if it's possible to get that done. Because I don't think she's the only one. This guy treated a lot of them.
And wonderful and gratifying and very, very moving to watch.
Oh, you're not kidding.
Hi.
How would you describe yourself before and then after the injection?
It's just truly amazing. The change is absolutely miraculous. It's amazing. Every day there seems to be something that's like, oh, I can do that now. It's amazing.
All right, I'm going to look it up. Etanercept and stroke. All right, you just saw what happened. Now, this is in the United States, Etanercept for post-stroke disabilities. Well, what do they recommend here for doctors? They say, as of this writing, the cost of this Etanercept is about $440 in U.S. currency to fix this stroke. Additional costs associated with the pre-treatment evaluation, so they can charge them a bunch more, and administration of Percipinol, whatever it is, are likely to be substantially higher. So in other words, you can gouge them on the inside, except, here's what they're going to recommend. Don't listen to them. Clinicians should counsel patients considering etanercept for treatment post-stroke disability. There is insufficient evidence to determine its effectiveness. For $440, don't waste your money, and that the treatment may be associated with adverse outcomes and high cost. Unbelievable. What's the cost of her life as it was? Recommendations for further research. Research is needed on effects of this post-stroke disability to minimize the risk of bias. Future studies of this treatment for post-stroke randomized allocate patients in a masked fashion to activate placebo treatment. Like she was just making it up that she got better. She was just making it up that she got better. Now this goes back 4 years ago, and it went way back past that. This is the kind of medicine we have in the United States. $440, that is the key. All right, so you see the TNF factor fixes brain strokes, which a TNF factor, I'm sure, is going to be created. Well, hold on. All right, here it is right here. Tumor necrosis factor, the thing they shot into her brain. It's an enzyme that converts. Here it is right here. It's tumor necrosis factor converting enzyme, a member of the family of metalloproteinase, which is disintegrating proteins, is responsible for the conversion of inactive TNFA precursors to active mature form. That should say form. Now, TNFA is a pleiotropic cytokine. There's a cytokine that contributes to cellular immunity and inflammatory response in wide range of inflammatory pathologies. After that, they have no clue about it. But here it is down here: Crohn's disease, cancer. Very few studies indicates its use in ocular pathologies. Very few studies indicate anything about this stuff. They just missed it all. And I don't know whether it's on purpose or not, but boy, I'll tell you, I would have had a hard time missing this stuff. Okay, doctor, back to you, sir. Dr. Mike Hansen, 285,000 subscribers. Let's see what we got, Doc. We're back on the COVID-19 destroying the body case. And I say it's 100% related to enzymes, which are 100% related to bacteria, which is 100% related to the way we live our lives, antibiotics, vaccines, and all of that stuff can destroy your gut bacteria.
Arteries and more clots that develop. That in turn leads to more endothelial dysfunction in the capillaries that surround the alveoli. Also, there's evidence that the virus attaches to the ACE2 receptors of the endothelial cells that line those capillaries, which further propagates inflammation and clotting. And in the cytokine storm that develops there.
The cytokine storm just means there's a whole batch of stuff going on, and then they say they're all inflammatory molecules. That's how they throw in a bunch of nonsense to make it. What's going on is there's a ton of inflammation. Call it anything you want.
RANTES, a chemokine, binds to the CCR5 receptor of CD4 and CD8 lymphocytes, and that causes those lymphocytes to infiltrate those areas of inflammation, and in doing so, further contributes towards the inflammatory reaction. This is why we're seeing low levels of CD4 and CD8 lymphocytes in severe COVID.
Why you're seeing these issues is because the bacteria does not have the enzymes to do the job. I showed how complicated these proteins are that are the enzymes. They are so freaking complicated that, and just like you saw, they put it in her brain, just like that she popped out of that. They are so powerful, and they say that that instant like that, if it wasn't for that enzyme, it would take 100 years to do the kind of chemistry they do before you can get the click off of your fingers. So all they're doing is finding molecules that they can't account for. And say, oh, we just found a whole bunch of this stuff over here and a whole bunch of, oh, well, now we know what's going on. Yeah, they're just lost, absolutely lost.
Endothelial damage can also lead to the development of antiphospholipid antibodies, and these antibodies are bad because they trigger the formation of blood clots. And that's why patients who have clots with the diagnosis of antiphospholipid antibody syndrome, they need to be on blood thinners. Also, 11.
Now, see, now, all of a sudden, we're going to put them on some kind of something that's going to change everything. If their body was doing the right chemistry, you wouldn't need any of this stuff. I'm telling you right now, if you take probiotics today, you will start to see an improvement tomorrow, and then it will get better and better. If you've got any issues at all, I mean, literally anything, you just saw. If you didn't see what I showed you, I cannot open your eyes.
7 out of the 12 patients in the study had underlying heart disease and were obese. These are known risk factors,
Hold
not
on,
just
let me
for
go back to that,
cardiovascular,
because that is
but blood
absolutely
clots.
important.
And that's why patients who have clots with the diagnosis of antiphospholipid antibody syndrome, they need to be on blood thinners. Also, 11 out of the 12 patients in the study had underlying heart disease and were obese. These are known risk factors, not just for cardiovascular disease, but also known risk factors for endothelial dysfunction, and are known risk factors for COVID. The endothelium is more susceptible to damage based on cardiovascular risk factors, such as men age 45 or older, women age 55 or older, smoking, high blood pressure, high cholesterol, diabetes, obesity, and lack of physical activity. So the big takeaways from the findings in this study.
Let me just say something. The big takeaway here, my friend, is that every one of those things is caused by gut dysbiosis. Now, you're going to have more physical activity if you feel better. So there's your physical activity. Obesity, all of those things are caused by problems with the gut. And if your gut is healthy, you're going to feel good, you're going to be active, you're going to digest your food correctly, and you're going to create the correct enzymes to deal with anything that tries to hurt you. You will hurt it first. I'm telling you. So here's the big takeaway. Let's see his big takeaway. So far, we found all the big takeaways have been completely nonsense as far as I'm concerned. All of these things, as you get older, your gut, you're taking more and more antibiotics and things. That's why. These people are taking antibiotics. That's 99% of the problem. And they get them from their doctors.
Diabetes, obesity,
All of those
and
are
lack of
drug-
physical activity. So the big takeaways from the findings in this study
Stay away
is that
from
most
doctors.
people who die of COVID, it's primarily a lung problem, either related to inflammation with ARDS and or blood clots. Even though blood thinners are not a cure for COVID per se, they do have the potential to save lives. The hard part is figuring out who is likely to develop clots and who should we give blood thinners to, and which blood thinners should we give, and should we give high doses of blood thinners or just the low dose prophylactic doses.
All right, I'm going to suggest this, sir. You're a doctor, and you should have the doctor incentive to see if you can heal your patients. I say when you get somebody that's sick, give them probiotics right away, and give them, and we can screw around with the ways of doing it, and give them a little bit of sulfur, give them a little bit of silica, and give them some Metamucil, basically that type of stuff, some bulk. We need to back up their system a little bit. We need to get some of this probiotics sitting in there a little bit, slam them with the probiotics. And then we need to get a little bit of extra chemistry there that facilitates those probiotics to become very active. We understand this. You guys do not. All right, so let's see what you're going to say here.
To further complicate matters, it's often hard to diagnose blood clots in hospitalized patients even before COVID came along. Usually it's easy to diagnose large blood clots in the veins of the legs, meaning DVT, by doing an ultrasound of the legs, even though ultrasound isn't 100% accurate. The way we typically diagnose pulmonary emboli is by getting a CT scan of the chest, while at the same time giving IV contrast, and this is called a CT angio or a CTA of the chest. The downside to doing this, well, there's several. One, you have to transport a patient to the CT scanner, and sometimes patients aren't stable enough to do that. Two, you risk spreading the virus to others in the hospital by transporting that patient.
I'm not going to bother going on with what he's getting into now. I think my points have been well made that we need to get probiotics into everybody's gut today. I mean today. I'm talking today. If you want to, but even if you have it, take it. Take the probiotics. But to get ahead of it, just as far as I'm concerned, go out with your mask and do anything you want. But as long as you got probiotics in your body, and you got good poop and everything's going good, and you don't have diarrhea and you're not throwing up and everything, I think you're good to go. And I think we can get back on track. And you, as a doctor, sir, are the kind of people that we need to step up and do what is necessary. And this is Dr. Mike Hansen. And I will put a link to him on this, and we'll see if I did put a, I commented obviously, and I am going to try to get a hold of him if he's really that interested in this COVID-19, just to do a quick study. I mean, we're only talking, you get a jar of this and you see what happens. If you get sick, start taking it right away. And I've had people say, yes, absolutely. Right away, I got better. I've had other ones say, I've been taking probiotics. Never, ever, ever do I have anything go wrong. I don't have anything go wrong. I haven't had any problems for years and years and years and years. And I don't get vaccines. I don't get any of that stuff. Anyway, and I don't do anything special, so don't ask me about my diet. I just eat normal stuff. I eat a lot of candy. I eat a lot of ice cream. I like brownies. And, I don't do anything special. I don't drink anymore, but I used to drink like crazy. Anyway, let's go call it quits for now. I think we got to get onto the probiotics. All right? And on the autism and everything, every single thing, autism, you got to talk to Marguerite. I want her to comment and leave a link to her somehow so that you people can get a hold of her. She's the expert in converting autistic kids to virtually normal kids. It was just heartwarming. She is so nice. John is so nice, and he's experiencing life now, which that would not have happened. Would not have happened without the probiotics. And of course, she searched for a solution where a lot of people are just going to accept what they're told. That's the difference. That is the big difference. And now I accept nothing. And I have found out, if you accept anything whatsoever, you have accepted something that you should not have accepted. All right, I love you all. God bless you, and get yourself healthy. All right, I love you.